Hospitals pushed to the brink and staff stretched thin. Pressure is mounting on healthcare systems coast to coast to coast.
We are seeing rural ERs and facilities closing because of lack of nursing staff. Wait times are going up almost on a weekly basis,
impacting both staff and patients alike.
I talked to a nurse the other day who said to me, I spend my entire shift apologizing to my patients.
Patients like Abigail Schellenberg, who waited in a Winnipeg emergency room for 19 hours for an injured ankle.
After waiting 10 hours in the waiting room and 9 in a personal room, I started to feel like I was being forgotten.
Just one experience in a healthcare system struggling to keep up. In rural Manitoba, staffing shortages are forcing emergency rooms to decrease hours or in some cases close altogether. A similar scenario in several parts of British Columbia, including the West Kootenays. In New Denver, the small village's ER operating hours have been reduced indefinitely.
We need to get back to a bit more community-based management to oversee these troubles that we have.
In Alberta, physician shortages forced the Fort Saskatchewan Hospital to close its obstetrics unit for at least 2 weeks. That means pregnant patients will need to drive to another hospital about half an hour away. The problem is also plaguing facilities in major Canadian cities. In Ottawa, Montfort Hospital closed its emergency department overnight this weekend amid what it calls an unprecedented shortage of nurses. Experts worry the situation could deteriorate even more this fall with another looming wave of COVID-19.
Traditionally, that's also when flu season kind of starts sort of around late October, November sort of time frame, and that has historically had impact on our acute care facilities as well.
A reason why Carr says we need to proceed with caution to avoid an unwelcome added stress on a healthcare system already pushed to the brink. Marney Blunt, Global News, Winnipeg.